Now then, it's time for perspective, and we're talking about breast cancer and what you can do to reduce your chances of having it, whether you're female or even male as well. Breast cancer, the most common cancer across the world for women, more than 2 million new cases every single year. Now, 1 in 7 women will also get breast cancer at some point in their life. Now, this month is Breast Cancer Awareness Month. It's known here in France as October Rose or Pink October. And joining me now from London is Thalie Martini. She's Chief Executive Officer at Breast Cancer UK. Thanks very much for being with us on the programme. I mean, those numbers that I just gave out there, I mean, they sound terrible, don't they? I mean, 2 million new cases every single year.
Yes, that's right. And this Breast Cancer Awareness Month, our campaign, which is our 25 Saves Lives campaign, is all about raising awareness that over 25% of those breast cancer cases are indeed preventable. So we're really celebrating the idea of resilience and taking control of our health. And the reason breast cancers are preventable is because there's a range of factors in our lives that can contribute to whether or not we develop those risks. And actually, there's things that we can do to reduce our risks.
So why are those things not being done then?
Well, I think it's about awareness. It's about understanding also that breast cancer is preventable. I mean, when we talk to our supporters and we talk to people at education presentations, a lot of people will say to us that they're not even aware that breast cancer is preventable, that we can reduce our risk by having a healthy diet, a Mediterranean diet, for example. Reducing our alcohol intake can reduce our risk. Sticking to a healthy weight, particularly when we're postmenopausal, that also reduces our risk. And really importantly, and this is the theme of our 25 Saves Lives campaign, having regular physical activity and exercise, so things like walking regularly, even doing the housework or going out and doing the gardening, all these things can significantly reduce our risk of developing breast cancer in the first place. But really importantly, it can reduce our risk of recurrence also after a diagnosis. And this is true of all age groups and even those people who have a family history of breast cancer.
So those are things that individuals can do. Presumably it's about governments as well and making sure that, for example, that the screening is there to detect these problems in the first place too.
Yes, that's right. But the other thing that's really important for individuals is to understand early detections and the fact that if we can find early signs of breast cancer early, our chances of making a full recovery are also very, very high. So one of the other things that we've done this Breast Cancer Awareness Month is we've launched a new Know Your Breast video. People can see it on our website if they go to breastcanceruk.org.uk. And it's a simple visual guide that shows how to check our breasts, what to look out for, and very importantly, if we notice signs of our breasts changing, then we must go and see our GP now more than ever, because if we find early signs of breast cancer, then we can make a full recovery.
Just going back to that screening point, I mean, are governments doing enough, though, to ensure that people have that screening that they need?
Well, I think it's a difficult thing for us to comment on. We're a breast cancer prevention charity. What we do say is that we know that people are feeling that they've got a lot less control over their lives at the moment. There's a range of things happening around them that might be preventing them from getting their early screening. But that means that prevention is more important now than ever. There are 11,000 lives that could be saved every year through prevention. And that's the message that we're getting across through our campaign. We want people to be aware that exercise is a great way to reduce our risk now and throughout our lives. And we're also encouraging people to get involved. We're offering free virtual Pilates classes every day, a free fitness festival to get people into the spirit, not just because it's great for reducing our breast cancer risk, but also to keep our immune system strong. That's another way to reduce our risk of developing breast cancer and many other diseases.
I had a bit of a look as well at the countries with the top percentage-wise number of cases. I mean, Belgium comes right at the top. The UK and France as well actually feature pretty highly, don't they? I mean, are there things going wrong in individual countries?
Well, there are signs. What we do see is that countries with the highest socioeconomic index actually have the highest incidence of breast cancer. And I think there's a very strong suggestion that there's a range of factors involved, not just lifestyle factors, but also environmental factors. Exposure to environmental risk factors such as chemicals also can play a role. There are lots of things out there suggesting that our lives in the highest socioeconomic countries are contributing to increasing our risk.
I mentioned male breast cancer. I mean, it's something that shouldn't be forgotten as well.
Absolutely. I mean, men do get breast cancer too, and all the advice we give around prevention applies to men as well. It's far less common, but the incidence rate since 1970 has gone up by about 30% in men as well, and it's gone up by a huge percentage in women also since 1970. And all of these suggest to us that there's something in our lifestyle which is contributing to the increased risk. So yes, absolutely, these messages are pertinent to men as well. Breast checking is pertinent to men as well. Men need to be just as aware of the risk, and they can be aware of the fact that there are things that they can do to reduce their risk. Exercise being one of the areas that there's a lot of evidence behind.
Let's not forget as well, of course, we're living in the middle of a pandemic at the moment, coronavirus. I mean, there have been a lot of fears, haven't there, that other problems such as breast cancer are really going to explode because people aren't going to the screening, they're not going to their GPs, they're not getting perhaps the hospital access that they need. How worried are you by that?
We are very concerned, and that's why we're pressing really hard our message that as individuals we can do things, but we're also very concerned as well for breast cancer research, for example. I mean, that's one of the areas that we invest in, and we have noticed, obviously, that that's at risk. So, yes, we are really concerned. What we want to make sure is that people have all the tools they need to do what they can do to reduce their risk, but equally, we need more support. Charities are under a huge amount of pressure. We need government to recognise that we play a significant role, particularly when it comes to research, as well as treatment, as well as ensuring that people have better screening outcomes as well. All of these things are under risk. We recognise it. Charities are doing the very best they can. We also need extra support.
Great to have you with us on the programme today. Thank you very much. That's Thalie Martini, Chief Executive Officer
Lovely
at Breast Cancer UK. Thanks very much.